Welcome to Florence Academy. Today I'm going to give you some tips and tricks and explain to you what part A listening of OET is like. So part A in OET will have two set of incomplete patient notes. Each will have uh, 12 questions. So part A in total will have 24 questions. And what you would listen is the audio related to this. And before you start listening to the audio, you will be getting 30 seconds to read and quickly go through the audio. So here it says you hear a consultant nurse talking to a patient called Michelle. You now have 30 seconds. So this is what will happen. You have the left side, which are the sections. So patient Michelle is 38, patient description. We'll just quickly go through it and then you'll start looking at the words before and after, the blanks before and after the words. So patient facing problem near. So definitely um, that would mean a part of her body she's having it from. So since when or what is the duration in the last so many days, a number of days, but resolved so many years back. Again, a number and can rate the pain. So this is the rating which is out of 10. No fever, no dash in urine observed. So that could be something like redness or something that is present in urine. So, but that was not there. That is why a no is used there. Medications, you should take some kind of medicine. The name might be specified. No dash to any other medicine. That could be an allergy. Social history, she is something 5 years back. So she may be solitary or she is retired. It could mean any of those kind of things. Last date of period was about so many back. So how many days, how many years, how many weeks, something related to that. No problems except 2 years back, but something happened there. So that might be something that you'll be looking for when the audio is going. Occasional smoker takes how much of wine a week. So that is a frequency. So you'll be listening. This is exactly what you'll be doing as much as possible in the 30 seconds of preparation time. After that, you'll be listening and answering at the same time. The answers would be from what the patient is saying. So just like what we saw just now, you'll be reading and predicting the answers in the first 30 seconds of preparation time. Then you'll be looking at the sections for help. Like I said, think of what the answers could be, just like what we discussed. And yes, when two blanks, sometimes the two blanks that you can see are pretty much closer to each other. That would that should motivate you. That requires you to do multitasking, which is listening, reading, writing, all three together. So maybe when you're writing this answer, you might have to keep your ears open to listen to the next answer as well. Yes, so multitasking is expected there. And if you think that you are lost, you don't know where the audio is going on, so it's best to still keep your eyes through it, so you know by looking at some words that where the audio is. And don't be tense. Try not to be tense, because even if you miss one answer, you have to get the remaining correct. So don't keep thinking about the first answer. If let's say if you didn't get something, then don't keep thinking about it. Move ahead and try to get the remaining answers correct. So that's all what I wanted to share today. Have a good day. Thank you. Bye.